Okay, well, let's get started then. Good evening, everybody. For those who don't know me, I'm Gabriel Almada. I'm the manager at FC Berlin and Berlin Sports Group. And we have a very interesting evening tonight. We have Dr. Schang from Cornell University. He's a top virologist. He's going to talk to us about the current status of the COVID-19, what to expect, what are the different measures, what's with all these vaccines coming from everywhere, which one is good, which one is not, are they all to be trusted, what are the different variants of the virus, we'll talk about all these things, and then we'll open for you. If you have any questions as well, you feel free to raise your hand using the Zoom app, and we'll definitely put you on the spot. But first of all, I would like to thank Luis for giving his time to do this for us. As you probably guess, I've known Luis for just a few years, more than 5, and 40. And then, so I know what kind of a professional he is. I know how knowledgeable he is. He's been giving interviews for different media in our home country, Argentina, for the past few months. So I asked him, will you be interested in doing one for us? And of course he said yes, because it's the kind of guy he is. And then I asked him, what about like in English? Will you do it in English? And of course he said, yeah, I would prefer to do it in English. It's much easier for me. And I fully understand that. So Luis, I would like for you, if you could introduce yourself briefly, say a few things about yourself.
Okay, first of all, since you said that we have known each other since 40 years ago, we met in kindergarten, of
Exactly.
course. Yeah. So I'm Luis Schang, originally from Argentina. I'm a veterinarian from Argentina. I came to the States to do a PhD. I did the PhD and I started working with viruses and antivirals. So I moved to human to do the postdoc in UPenn in Philadelphia, where I started working with human herpes. I stayed 4 years in Philadelphia and then I moved to Canada. I'm Canadian, true Canadian from Edmonton, where it's really winter, not like you guys. So I moved to Edmonton. I lived in Edmonton for 16 years. I did the career in the Faculty of Medicine there. And a few years ago, they came recruiting from Cornell. So I moved back to the States where I'm now. I have been working with the concept of broad spectrum antivirals for approximately 20 years, with the idea of we need to have drugs against viruses that we do not even know that they exist yet, because they are going to come. Unfortunately, we were not on time, as you can see, but that was in part because 20 years ago, the idea of broad spectrum antiviral was not very popular. As you may realize, it has changed drastically now. So we have been working already for 1 year. Actually, for more than 1 year, I have been involved in the International Society for Antiviral Research, of which I am a member, in tracking the virus and trying to provide support for research on this virus. And since March last year, working myself with the virus, and we work in tissue culture and animal models, and something that is controversial, but it's an important part to be able to move into humans. So that's in a nutshell what I do.
Wow, okay, very impressive. So Luis, as I mentioned in the introduction, you've been talking to a lot of media back at home. I don't know if you have been doing the same in other places, but I bet the questions are always the same, right? What can we expect? What is the current situation? What do you know about the vaccines? So could you start by telling us where are we right now with regards to this pandemic?
Yeah, and I like to emphasize always, it's not an optimistic, but I'm realistic. 1 year ago, most people here didn't know that this virus exists. 1 year and 1 month ago, nobody knew that this virus exists. 1 year and 3 months ago, nobody knew there was a new virus. Okay, we have learned a lot and we have accomplished a lot. Now the challenge is tough. This is a very high challenge. You have a virus spreading through the human population, and because the way that we have set the world in the 21st century, viruses don't travel with birds or bats anymore. They travel in airplanes. It's us. We are very interconnected. So by the time that we first find that there is a virus in Wuhan, China, the virus is already all over the world, which was one of the common mistakes that people still in February, March last year, they thought you can contain the virus. You can't. And that's the reality of the 21st century. So we have moved quite a lot from that time. I think that the most important piece of information that we it took only a few months, but may have been too long, was to find out that there is a significant extent of asymptomatic transmission. That is, people who have no symptoms whatsoever, but they are infected and they can spread the virus. And for everybody who's confused about the advice about mask or face mask wearing, the idea of the face mask is to prevent spreading the virus to another person, not so much to protect oneself. So early on, when we didn't know about the asymptomatic transmission, the recommendation was, if you have symptoms, you must wear a mask. If you don't have symptoms, you don't need to, and masks are in limited supply, so if you can't, don't use it. When we found out that the asymptomatic transmission was a big issue, that's where the big change happened, and everybody should be wearing a mask. So I know that that created a little of confusion, and in retrospect, the recommendations were a little bit too early and a little bit too positive in the way in which they were said who should and should not wear a mask. And yeah, we have learned better for a next pandemic. But it's not that anything really has changed. The virus was always the same, the situation was always the same, but we had to acquire the knowledge about the virus. Other than that, in 1 year, we have vaccines. And that is unheard of in the history of humanity. Now, I don't want to scare anybody, because the pace of development of the vaccine was not particularly fast. I know that doesn't sound convincing, but so it happens. There were 2 previous coronaviruses, which probably nobody has heard much. Well, SARS, I'm sure people have heard. Probably MERS, we haven't heard much. Yeah. But those were 2, if you want to call it, false alarms. So SARS was a very serious virus, but it wasn't very easy to spread. But we got it in Canada. We had a problem in Canada. MERS is another virus. It comes from the camels and it keeps on coming into humans, produces small outbreaks. Because of those 2, they're coronaviruses and they are relatively closely related to SARS-CoV-2. Because of those 2 viruses, they were probably more than 10 years of, more than 10 years, probably more like around 20 years of development of these types of vaccines. When the new virus was identified, the only thing that really needed to be done was to change the specific protein that is expressed in the vaccine from the original SARS or MERS to the one of SARS-CoV-2. But it's not that people started from scratch with knowing nothing. The platform, the systems to produce the vaccine were already established. The only thing that was done was to change the protein that was expressed. And that's why the technical development was so fast. The clinical development was very fast, thanks to us, human beings. Because when the vaccines got into clinical trials, we got the second, third wave, whatever you want to call it, and people started getting infected like crazy. So literally, what people had thought was going to take 6 months to collect the number of cases were collected in 2-3 months. And that was our human beings' contribution in spreading the virus and infecting everybody. So there was nothing mysterious why it was fast. On the other side, there was something that was done different, but that was an economic decision. The vaccines started to be produced before we knew if they worked. And that was a huge risk, because if they had not worked, all that money would have been wasted. At the same time, it was a necessary risk, because in this case, there was no reason why we should be waiting to know if a vaccine is working to start producing, which takes 1 more year of delay. Okay, so it was a calculated risk. It was a big monetary risk, not a health risk at all. So we have learned a lot, and we are much better than we would have been, I would say, just 10 years ago. If this pandemic had happened 10 years ago, it would have been much worse than what it is now.
Wow, and yeah, I agree. There were no people were talking about COVID-19 and coronavirus as if they were the same thing. And it's about, and to me, it was always like, well, we're talking about pop and Coca-Cola. COVID-19 is just one flavor of coronavirus. And you're right, SARS affected Canada big time. I remember the times I was working in hospitals already, and there were many I couldn't go to, because that's where they had all the SARS patients in Toronto. It was by the time we were having the Pan American Games in Toronto. I remember that well. And I also knew, because I have read and because I have talked to you before about the vaccines and what a miracle it was that it only took a year, but it's like, yeah, it only took a year for this particular version of the coronavirus, but there was so much work behind. Now, we do hear there's a whole lot of different vaccines now coming, like Pfizer and AstraZeneca, and then we have the Sputnik that everybody's talking about in our home country. And we got flooded by comments and, oh, this one is like 96% effective and this one is 92.5, except but under different conditions. And so my question to you is what is there any difference between the vaccines and then I guess the silly, even stupid question is like, is it recommended you take any of them?
Okay, I'm going to start. I don't give recommendations. I just say what I do. I'm in the waiting list because I work with the virus. I'm in the 1B priority in the waiting list to get a vaccine. I don't know which vaccine is going to be as anybody else, and I don't care. I have no concerns about getting either one of them. Now, we are in North America, and the vaccines that are approved here in the States at this moment and in Canada are Pfizer and Moderna. And both of them are a relatively new type of vaccine, which is called messenger RNA vaccine, in which the vaccine contains a piece of RNA that expresses the protein of the virus that it trains the immune system. Now, I just want to give everybody a little bit of perspective, because we talk about it's a new type of vaccine. There are people here who are old enough that were vaccinated perhaps with the live polio vaccine, and maybe I'm not the only one. And many people, well, everybody in the world at the time, we were vaccinated with the live polio vaccine. That was a virus whose genome is RNA. So we were vaccinated with an RNA vaccine. Instead of being the RNA delivered by a virus, the RNA is delivered by an artificial system in which there is no other viral component at all. So if anything, they are safer than what we used to have, okay? So these vaccines, again, the Moderna and the Pfizer, that messenger RNA gets into the cell in a vehicle that contains mostly lipids, nothing mysterious. Once inside the cell, the messenger RNA is translated or converted into the protein. The cell shows the protein, and that trains the immune system to recognize the virus. The protein that it expresses is a so-called S or spike protein of coronavirus, which is a protein that is on the outside of the virus that the immune system can see really well and produce antibodies to neutralize the virus. There is a slight difference between the Pfizer and the Moderna vaccine, in which it's very technical, but the Pfizer vaccine, the RNA actually also encodes for another protein that amplifies the amount of RNA. And because of that, the total amount of RNA that we get in the vaccine for the Pfizer is 30 micrograms, that's the unit, and for Moderna is 100 micrograms. But it's a technical difference. It really doesn't seem to affect much. Then there is another type of vaccines that are being used, and in Europe and the United Kingdom, the AstraZeneca or Oxford is one of them. The Sputnik that Gabriel was talking is another one of them. They are the Janssen that is actually coming out online now and with good results is another type. And these vaccines, that gene, that protein of the coronavirus is actually expressed by another virus, which is called adenovirus. Now, adenovirus is a very common type of virus. We all are infected with adenovirus many times in our lives, that by and large produces no disease whatsoever. However, to make it safer, the adenovirus that is used for the vaccine cannot replicate itself. It enters into one cell, expresses the proteins, including the S protein, but can't replicate. And again, the adenovirus vector has been used for many years in a variety of settings. So it's nothing that is really new now. What is new is that inside that vector, the S protein was expressed. Now, the AstraZeneca or Oxford vaccine is approved in many places. The Janssen is coming now online. The Sputnik is approved in a few places. The major difference between the three would be that the Janssen vaccine, they apply for approval for one dose only, and they reach the endpoint, so they're going to get approval for one shot only. All the other vaccines so far require 2 shots. Now, for the individual, that's not a big deal. But when we have to produce vaccines for 8 billion people, whether to produce 8 billion doses or 16 billion doses is a big difference. Okay. One of the good things is that those technologies, the messenger RNA and the adenovirus, use different production systems, different production lines, and therefore having both of them working means that we can have more doses sooner. There is another vaccine that is coming online, Novavax, which is that famous S protein. It's just the protein purified and expressed in a certain way to be a good immunogen to train the immune system. So that is going to open yet another production line. So we have had teething problems, no question about the vaccine production. Having said that, we have vaccinated more than 100 million people by now, around 120 million people in the world. That's quite an accomplishment, considering that basically we started a little bit more than a month ago. And the production rate is increasing. So vaccines will be increasing. Of the vaccines that are approved here, I will have no preference for either one of them. There are other vaccine technologies, but they are not reaching here, so I'm not going to be talking about them.
Mm-hmm. Okay, good. That's what I knew you were going to say. Any vaccine is a good vaccine, right? It's always better to be vaccinated than just to not be. And
just one thing I have to say, myself, as mostly everybody in the scientific community, we were astonished about the success of these vaccines. We were thinking as a good result, probably 70% protection, but they actually come out with very, very good protection. These are very good vaccines.
You froze there.
This was the dream come true.
Sorry, we lost your last comment.
Okay. That for anybody working on vaccines or using vaccines, this was a dream come true on the first attempt. They are really good vaccines. Some of them may be a little bit better. All of them are very good.
That's good. That's good to hear. And I know here in Canada they were estimating with all the vaccines they have been purchased and everything, they were estimating that by August, September, pretty much everybody would be vaccinated. I was looking at there's some link to the government sites and even the region where we live that were saying how many people have been vaccinated so far. I think here in the region of Waterloo where we live, out of 600,000 people that live here, only 18,000 have been vaccinated. Only 5,000 of them, they got the 2 doses. They're always obviously starting with the healthcare people, like people working in hospitals and nursing homes, and all. So it's understandable. I don't know what the forecast is in the U.S. when they expect to have most, if not all, people vaccinated. You think this is a feasible thing to say we'll have everybody vaccinated, or it will get to a point that because so many people have been already vaccinated, it will be that this term that everybody's talking about, like the herd immunity, will kick in, and then we will be able to start gradually going back to like what we used to know as a normal life.
Okay, yeah, first of all, it's very difficult to predict when everybody will be vaccinated. So let's go by parts. This is last time that we had to vaccinate the entire population of the world, most people here were not even born because it was against pox virus.
Yeah.
Okay, that was the last eradication campaign in which we needed to vaccinate everybody in the world. The world population was far smaller. The ways of producing the vaccine were very different. So the challenge is really big. And another additional challenge that we have to keep 2 doses for most of the vaccines. So the final percentage of people when they're going to be totally vaccinated is very difficult, and I would not dare to put a date. At the same time, because the way that this virus spreads, there are groups of people that are critical to the epidemiology. And several of those groups of people are actually the ones in the first priority. So the healthcare workers is not just to protect the healthcare workers, but the healthcare workers, because by necessity they are exposed to the virus, act as vehicles. They can transfer the virus to new people who actually leave the hospital. So you need to vaccinate the healthcare workers, not just because of them, which is a good reason, but also because of the very important epidemiological role that they can play. That one is being neutralized already. The other very important group is elderly people, particularly living in assisted living facilities, where the virus amplifies quite drastically and quite well. Again, because of need, because those are very vulnerable people to the infection, that amplification circle is going to be neutralized relatively soon. There are other key players in the epidemiology that are more difficult to reach because, for example, they can be workers, for example, in meat pack factories, meat pack plants. That has been one of the sources of cases and outbreaks, where everybody has to walk in and out at the same time. Inside the meat pack packing plant, everything is very controlled and there is probably very little transmission, but getting in and out is a big problem. And there are many other situations like that. So you don't need to vaccinate everybody in order to change. You don't need to reach a magic number, but you need to neutralize all those amplification circuits. That is a realistic thing. The times that you're talking about seem realistic. So, but the world again is not going to change overnight. It's not that when there is X number of vaccinations, we're going to go back to where we were. I think that we have learned a few lessons about a few things that we should be very aware and careful. I expect that face mask wearing in public will stay for quite some time until we are fairly sure, because that's really a very minor inconvenience and can play a big role. I don't know when movie theaters will open, for example. Those are other places that are complicated, or discos or clubs. So again, it's going to be one step at the time and tentatively, and you know, we need to do our part because there are people who so the ones of us who can work remotely, let's not contribute to the chain. Let's stay working remotely for as long as we can. I like playing soccer too. I mean, Gabriel can say that I'm not the best player, but I enjoy playing soccer. But I stopped playing soccer last year because that's a group of people with whom I don't need to have a contact. That's not my profession. That's not what I do. What I do is to be a university professor. So it's that type of things. We have to be conscious, minimize the number of contacts that we have in order to allow the people who need to do things that require contacts to be able to do it without increasing the risk. But when it's going to be everybody or 50 or 70% vaccinated, that's a little bit difficult to predict.
Yeah, I like what you said about the main reason for vaccinating healthcare workers first is because of the role they play. It's just to protect the people that interact with them. It's the same concept that you mentioned before about wearing the mask. You don't wear the mask so you don't get the virus. You mostly wear the mask so you don't transmit the virus to other people. So it's the same thing. You're vaccinating the healthcare workers here, the first line people, like we call them, for the same reason. With regards to mitigating or minimizing the risk for exposure, like you said, there's some things, that some social events like going to the movies, or in your case playing soccer, that you have to make the difficult decision to stop doing, or when the movie theaters, they will probably be closed for the time being. But there's other things that are, when you know, in our case, for example, Luis, and like in the last year, since March in 2020 until now, the whole club had 6 official games, and it's just a handful. It's pretty much the same number of scrimmages or friendly games that we had, and a couple of events. That was it. And the games we played were in like September, October, and with like all of measures, people could not be on the sidelines. So like all the parents and people watching, they were outside of the field. And we had to screen everybody, sign forms, like measure temperature, everything, right? And it was only the 22 players and the subs and the referees and the coaches on the field. That was it. And now we cannot even do that right now. Hopefully we'll be soon coming. But this is the kicker to my next question. Like, we are currently in lockdown here in Ontario, at least, since December the 26th, and it was announced today that it was going to continue for another week until February 16th. which means we shouldn't be going out other than to work or grocery shopping or gas or the pharmacy, something like that. But we see that other provinces in Canada, and particularly other states in the US, are in completely different situations. Some are almost like it almost looks like a green, like everything's fine. Like we mostly hear from our players or graduates that are different states that are currently playing games and doing an almost normal life. It depends on the state. So how does it work in the states? Like every state decides what to do, or is it like because of the region, because of the density of population? Like I mentioned, some states are less populated than others. Like it's not the same to say Pennsylvania than Montana. So how does it work in there?
So it's a state jurisdiction. The federal government has only authority over basically interstate trade, but not inside the state. So different states have taken very different approaches. Here in the state of New York, for example, is a regional approach because the state of New York has New York City, which, as you know, is a very urban and densely populated area, but also has this part of upstate New York, which is a very rural and sparsely populated area. So each state has done things in a very different way, which from the epidemiological perspective is never an optimal situation because there is travel in between states, people move between states. So the fact that you have different approaches doesn't really lend itself to be an effective approach to overall tackle the outbreak. I don't know the situation state by state, but I do know that there are states that have basically no restrictions whatsoever, even to gatherings. I mean, as you know, there was recently a Super Bowl and there were 25,000 people, if I remember well, of which a number, 7,500, if I remember well, were health workers vaccinated, but I don't know if anybody else was vaccinated or not, and so forth. And here in the state of New York, of course, that would be unthinkable. When the Bills played the playoff game, they were allowed to get 8,000 people in the entire stadium, which, of course, as you can realize, you can manage and you can keep a density much lower. So it's all over the place.
Yeah, understandable. What do you think about the? There's other examples, good and bad, from other places in the world, right? We've heard so much about the way Australia and New Zealand dealt with COVID, but we also heard so much about the way places like Sweden dealt with COVID. And what do you think about those experiences? Like they had very distinct outcomes, right? And
I'm not going to talk about what I think. I have my opinion, of course, but I'm just going to refer to the numbers. So Sweden was very unique in that they really didn't take any official approach to prevent the spread. I don't know the real reasons. The official explanation was trying to get so-called herd immunity, people infected. As Fauci had explained many times here in the States, in order to get herd immunity, however, the mortality among the elder people would be very severe. So it would work, but the cost is very high. But regardless of the real reasons or why Sweden did what it did, the interesting thing is that not only they have the worst mortality in Scandinavia and the worst everything in Scandinavia, they also had the worst loss of GDP last year. So Norway, who actually had very real lockdowns, dealt with the spread much better. As a consequence of that, the economic pain was shorter and much lighter. I don't have the dates for the full year. I'm sorry, that was only the first 2 quarters. I'm waiting now to see the GDP for the full year to see how it correlates. So in general, there was a trend in the first 2 quarters of last year. The countries that did worse economically were not the ones with the worst lockdowns, but with the ones with the worst mortalities. So the real cause of the economic loss, the major economic loss, was the outbreaks, not the measures to fight the outbreak. We'll see if it holds true for the full year. Again, I'm waiting for the data to see what is the outcome. In countries like Australia, New Zealand, but also Taiwan, for example, Vietnam, which are not necessarily Vietnam is not a rich country. South Korea is a rich country. Those countries had previous experience with the original SARS, and they did things differently from the beginning. And I would say that the major difference probably was that they knew that they were not going to prevent the virus from entering, but they were in the lookout for the virus once it was there. And they were ready in advance. The population were also far more educated about the outbreaks and the consequences. As you know very well, at least here in the States, but I understand the same in Canada, although I wasn't there, I have heard enough, and for certain in Argentina, many people resisted wearing face masks, which is quite frankly a fairly minor inconvenience, even if it doesn't work. I really have a difficulty seeing why somebody would fight against doing it when it can possibly help and the cost is minimum. And as I like to say, I mean, here in Canada, in the States, a generation ago, people were asked to give their lives for the country. Now we were just asked to cover our faces and lay on the couch. Okay, I don't think that is such a big sacrifice. So I think that in the end, it comes to all of us and our attitudes and what we do. Lockdowns are a drastic measure. I think they would be much better if they were never necessary, if we understood and we behaved appropriately. How effective lockdowns are, in cases of emergency, they have definitely worked. In cases of very drastic lockdowns, like in China, they have worked. In other places, they have not worked so well.
For us, I think for us being a club that works mostly with youth, right, with people below the age of 25, I think the worst part of the lockdown was making sure that we stay in touch with our players, because for a teenager, you know this very well, right? For a teenager in particular, like social life is so important, and then suddenly not being able to be with their group of friends and their loved ones, it takes a big toll. We've done what we could. Our players' families have been supportive as well. But I think that's the biggest toll that I've seen. I mean, players who were upset and even sad, depressed, because they had to be home and they couldn't see their friends. And it's not the same for me and you to be talking via Zoom than being in person, like last year when I was at your place. It's not the same but we can adjust. I mean, it's different. I mean, me and you, like people our age, they can definitely live with like just not being at home and doing having no social interaction in person. But it's been very difficult for us to deal with our players. And but I think we have done a good job at staying in touch and staying engaged with them. Some players have, of course, been more engaged than others, but we're also taking every opportunity we have to bring them back, right? So right now, for us as a club, we can only do just like very small sessions with our pro players, right? Because we have two pro teams, pro athletes or semi-pro athletes that are allowed to stay training. But now, as of next week, hopefully we will get to reopen our facility and have again in groups of like 8 people and everybody with the mask and with the controls and everything, to have people come and train again. We don't know when we're going to be able to play again, but we know that we very soon will be able to train again, and that helps a lot, because our players get to just go out, see their friends, and like interact with each other and everything. But the other part is difficult. But none of these, like you said, none of these justifies having like resistance to wear a mask or to protect yourself, or like just again, it's not that you're doing this for yourself. It's not that you when we're wearing a mask, I'm not going to catch this thing. It's like so you don't transmit it to people who are a little more vulnerable than you. So
give me one moment, because the dog is barking. I have to get the dog inside. I'll be back in a second.
Okay, no problem. In the meantime, I'll ask if anybody in attendance has any questions. You can either raise your hand, or you can comment on there's a chat in here. So feel free. We still have a few more minutes, So feel free to let us know. Santiago, I don't know if you're keeping track of who's on the call, but if you guys have anything you want to ask, you would like to know, I still have a couple more questions to go through with Luis. So just let me know.
Everything looks good. I sent you an email. We got some questions via email, but they're a little too, in my opinion, specific. So I'll try to maybe generalize them because I don't think it's appropriate to like ask for medical advice. I think that's just not appropriate. So we'll just do it in a different way where we can get general information without going too far.
Okay, yeah, I sorry, I haven't looked. I had to shut down my Outlook and Teams and all the stuff because it kept constantly beeping with all the messages I was getting from work. So I missed the email. Luis, I was going to ask you another question about the you're on mute. A question about the different variants that they're talking about, the South African, all the different. Yeah, you can. Let me see if I can unmute you. Yeah, there you go.
Thank you.
I don't know how that happened. So all the different different variants of the virus that are currently affecting. What is there? Are there different in the way they will be attacked? Like, is the vaccines that we currently have, are they good for those variants? Like, people don't know. I don't know, so I'm not going to pretend that I do.
Yeah, I'll answer that. Before, a quick comment though, because the isolation is not only tough for young people. I mean, if you think at the other end of the spectrum for the elderly, that's also a very, very, very challenging thing, not to be able to see their children, grandchildren, and so forth, and to be, in some cases, living alone, totally isolated.
Yeah.
It is tough. What I wanted to say is that it is, but it's very easy for young people used to play soccer 3 times a week, all of the time being isolated. It's very tough.
Yeah, absolutely. I was mentioning the kids because that's the group we work with, right?
No, but what I tried to say is that because I made the comment earlier on that a generation before they were asked to go to war, and I did it lightly and tongue in cheek, but please don't think that it's dismissive to the effort that really requires to the isolation. It's tough, no question.
Mm-hmm. Yeah.
Okay. So yeah, about the different variants. So viruses are weird creatures, and they actually work slightly different as we do. So the genetics of viruses is probabilistic. So viruses exist not just as one genome or one type, but a swarm of genomes that are in equilibrium. So the slightly different versions of the virus interconvert constantly. Now, when the new virus comes into a new population, as it happens with this virus coming into the human population, usually it's just one event. So the viral genomes are very homogeneous. Now, as the infection progresses and more people are being infected, you start generating that diversity, which is normal. And that's what we are seeing. And those are the variants. Very important to make the distinction. They are variants, not strains. So the difference is that the strains would be seriously different and would be a real concern. So far, they are variants. They are things that we have to keep a watchful eye on to see how it moves. It's nothing unexpected. It's fully expected. Some of them probably transmit a little bit better. It's unclear if any one of them is actually a little bit more pathogenic. And with respect to the vaccines, it's still a little bit way too early to say, and to be quite honest, it's a little bit too early to be concerned about. Okay, at this moment, we should be concerned about getting enough people vaccinated and getting protection. Whether that protection would be ideal against some variants or not, we don't know, and I don't think it's that important yet. At the same time, from the watchful eye perspective, yes, of course, we know how to produce the different vaccines against different variants. So there is no reason why not to start right now. And in fact, it is starting right now. So just in case, if it was necessary, yes, you could have new vaccines that are more active against the different variants. Now, to date, the news came that South Africa is putting on hold the vaccination with the Sanofi, AstraZeneca,
yeah.
Chadox, Oxford vaccine, because in a small clinical trial, they said they didn't produce protection against mild disease. We haven't seen the numbers, we haven't seen the data, we haven't seen anything. So I can't really provide any informed opinion about that. The only thing I'm going to say, I'm looking forward to see what the actual numbers are. What I'm going to say is that the protection conferred by several vaccines, not surprisingly, is different in different locations. And the ones that have been tested, it's higher in North America and Europe, somewhat lower in South America, and somewhat lower in Africa. And that was before variants and now with variants and so forth. And there are many reasons why that is not necessarily surprising. So again, it's something to the CDC here and in Canada, they are keeping an eye and they are monitoring and following. And it's not going to happen that it's going to catch us by surprise. And in case that we need new vaccines, they will be there. So at the moment, I think that we should be more concerned about getting our vaccinations, getting enough doses, and vaccinating enough people.
Okay.
There's a question in the chat, by the way.
Yes, I was going to mention that one. The question is from Adriana, I think, and she says that there's a lot of talk about trying to get everybody vaccinated by September here in Canada, but that she hasn't heard anything about vaccinating children. So are we taking that into account? Is there any plans for children?
That's an excellent question.
Oh, you froze.
When we develop a new vaccine or a new drug, that's an excellent question. What happens when we develop any new vaccine or any new drug, we have to perform clinical trials, and the first volunteers are considered the people at the least risk and the ones that are more free to provide consent. So we're talking about adults. Once the clinical trials show that there's an effect on adults, you can start moving into more vulnerable populations that may not be so free to give consent. So it's nothing unusual, but there are not yet clinical trials on children with these vaccines. So it's not to say that they are dangerous, it's not to say that they will not work, but we still don't know. And it will happen on due time. This is not a priority at the moment. At the moment, the priority is vaccinating everybody who is, depending on the country, 16 or 18 or older, and at the same time, try to find out how much younger we need to vaccinate and how much younger we're going to do the clinical trials. That's an excellent question. Very smart. Very smart.
Do you expect this vaccine will make it into the regular calendar for kids in the near future? Like they will get all the I mean, once we
for some time,
5-10 years from now, huh?
For some time, I presume, yes. It's very likely that this virus is going to stay with us as humans. It's very likely that after the first serious outbreak, it's going to be just another virus. For the ones of us who are from Latin America, no closer, but everybody may have heard a few years ago about Zika virus. Yeah. When it first came into Latin America and the first wave producing microcephaly and so many problems. As you have not heard much about it recently, is because once the virus established itself into the population and there is some level of immunity and so forth, it's not such a large number as to make the big problems. So one can expect similar evolution happening in the interaction between the SARS-CoV-2 and humans. But for the time being, we don't know how long the immunity will last, but probably we will need some boosts periodically. That would be a logical prediction. And yeah, until some moment probably would not be necessary any longer.
Good. Luis, I have one final question myself, but this is like a touchy one. I'm not sure if you how you want to address it or if you actually have an opinion. And this is the role of the media in this whole pandemic. Like from from media who are like contributing to hysteria every time there's a new variant of the virus, or like sending, we see it here in Canada, like posting daily and sometimes hourly updates on how many cases, and they will say 78 new cases in the region today, but then when you go into you start to look and read the article, they say, but also another 120 were resolved. So it's like the balance is minus 15. We have the 78 new cases. So there's a whole, like every newscast, every newspaper, every media outlet you can see begins with really alarming numbers, and to me, in many cases, it's just contributing to the mass hysteria out of ignorance. Do you think that this is a case that we're actually handling this really badly at the media level?
I'm not going to give opinion about media or anything, but there are a couple of things that are important to keep in mind. One of them is that in all the pandemic preparedness plans that we had, we certainly had overlooked the issue of communications, and particularly the issue of communications in the times of the internet. There is a natural tension between research and newscast, and I have interacted with enough reporters. News is what happened today. In science, we need the time to sort through to find out what the evidence is really telling us. So the scientific communication, a paper that is published as a scientist, is published such that other scientists can challenge what is in there. And it's only when there is enough evidence collected from that we reach what people tend to call a consensus, which is not a consensus at all. It is, okay, now I am convinced by the body of evidence, which is not the last paper that was published yesterday. It's everything that was published ever on the topic, or things that were not published. So there is that tension in between newscast and science that these days, with the preprints being available or anything, every reporter tries to get the latest news. And the latest news is presented as a fact, when in reality is presented as what somebody had just put forward for analysis. And that creates a very difficult situation, because indeed, if you go through the news or even through the scientific articles, there is a new variant, there is a new variant, there is new this, there is new that. What does it all mean? And we don't have a good pipeline set up from the scientific community or from the reporting or from the public health or government on how to present all that information in a comprehensible manner that is also timely. And that is a challenge. So there is a crisis in the dissemination of information, no question about it. I'm not going to point fingers to say somebody to blame. To be quite honest, even as a scientist, we have to learn to write papers in a different way, because our audience is not anymore other scientists as it used to be. Our audience are everybody. The reporters and common people will read those papers. So we have to be aware, and we have to do things differently. It's a very, very complex issue, but it is really a big issue. In this pandemic, it has complicated the situation, because people faced with contradictory information and always presented as facts. Of course, nobody knows what to do. Yeah.
Thank you.
It is a challenge.
It definitely is. Definitely is. Luis, I have one final question. It's like a follow-up to the previous question on the vaccination and the children. And like Adriana again asking if we can still reach herd immunity without having the children vaccinated.
Oh, that's a tough question to answer. I don't know who's the person asking what you want to study or anything, but yeah, those are very good questions. That goes down to the role that the schools play in the amplification circle and the epidemiology of this disease. And we don't really have a good answer. What we do have is a series of analyses across the world, and definitely it appears from those type of analyses that the schools do act epidemiological as an important link. So if that really holds true, it's going to be a problem until we vaccinate children in some extent. Yes, it will be. At the same time, let's not forget that the prognosis or the problem with this disease, the major risk factor is age. And there are other very well-known risk factors as comorbidities. If we get good coverage of that particular population, the circulation of the virus doesn't have the same consequences. So there is no perfect answer. We don't really know the answer. We're going to find out as it goes. But again, it's very particular epidemiology. So we have to be careful when we talk about herd immunity, that not every person plays the same role in the epidemiology of this virus. It's not just age, but it's occupation. I mean, any place where there is regular gathering of the same people with certain periodicity in an enclosed environment, it's a high risk of being an amplification circle. And that could be a religious group, that could be a place of work, that could be a school. So when we talk about herd immunity, it's not just any 70% is the same. Some groups are very key, and the role of the children of the school age, we're going to learn it as we go.
Okay.
Excellent question. Excellent question.
Thank you, Luis. That's all the questions I have, and we've been at it for 50 plus minutes already. Santiago, do you have anything else you would like to add?
Honestly, no. I think this was a very productive conversation. I actually learned a lot. I think more people just need to hear this sort of information and just kind of wade through an actual academic source rather than the media outlets that we get around here. So it's good to hear it from someone who's actually working on it. So we appreciate it.
The only thing I would like to add to everybody is, again, regardless of lockdowns or governments or anything like that, in the end, is we are the source of the problem or the source of the solution. We all have to do what we can do in order to contribute to the solution. Again, the ones of us who can work remotely, we have to do it. Some people can't work remotely, so we have to make sure that they can do what they do by doing our side, wearing face masks, minimizing the number of contacts, getting vaccinated whenever we can. All those things make a big difference. And if we all pull in the same direction, we're going to get out much faster. The economy is going to recover much faster. There are many people hurting really, really badly because of the economic situation. And the sooner we can get out of the pandemic, the better we're all going to be. And going to the mask again, yes, it protects others, but I want to remind everybody that the pandemic affects us all, one way or another. So when we're protecting others, we are protecting ourselves. When we are helping others, we are helping ourselves. The more that we can help others, the better for us. So it's one of those rare situations in which the selfish and the altruism go exactly in the same direction. The more we can do to cut the epidemiology of this virus, the better we're all going to be.
Okay, well, Luis, on behalf of Berlin Sports Group, but also personally on my behalf, I would like to thank you very, very much for giving an hour of your time to share your knowledge and your experience with us. I don't know if it's very common for a sports club to be doing this kind of events, but I found it was a very interesting, an incredible learning experience for all of us to dispel some myth and some like bad information that we all have, that we all are constantly bombarded with, and just to know more about what's going on and just to get the word of somebody who knows what's going on. So again, I thank you so very much for your time. I thank all the people who took the time to attend. As I mentioned to you, this is going to be uploaded to our own Facebook and from YouTube to our own Facebook and our own website pages, and for other people to see. So thank you very much. If you want to say anything else, this is your time.
Yeah, you really don't have to thank me for the time, because really my virology is not to publish papers or so forth, but to try to help however I can help. Part of that is doing the research, of course, and finding new knowledge. Part of that work in antivirals, but part of that is trying to explain what the situation is and so forth. Actually, I want to thank you, because as you mentioned, it's not normal for a football club or a soccer club, whatever you want to call it,
Football,
to organize something like this. I can make a bad joke. When I was coaching and my children were playing, the days that they play well, I tell them, today you play football. The other days they were playing soccer.
Well, again, Luis, thank you very much. Hope you have a wonderful rest of the day, and we'll stay in touch. You know, for these or for other reasons, we'll stay in touch. Again, on behalf of the whole club, many thanks for this.
No, thank you all very much for your time, and I hope that it helped a little bit. Feel free to ask any questions that you may have down the road. Except for, as Santiago mentioned, definitely nothing that is about medical advice. I'm not a doctor. I cannot give medical advice, but general questions, very happy to answer anything.
Perfect. Thank you.
All right. Have a good night, guys.
Thank you so much.
Good night, everybody.
Bye.